Hi, my name is Abby Osborne, and this is my informational speech on radiology. And here's my audience. Woo! Okay. Okay, so have you ever wondered what the inside of your body looks like? Well, that's what the field of radiology allows you to do. Today, I'm going to inform you a little bit about the history of radiology, the different types of scans that a radiologist will perform and read, and also the different careers in radiology. I've been interested in the field of radiology since I was about a junior in high school when I had a knee injury from soccer, and I got to work with radiologists and the different types of scans, and then actually I got to shadow a radiologist, and that's when I became extremely interested in it. It's a really growing field because there's new technologies and it's constantly changing and developing new ways to help patients. Okay, so here's a little bit about a history of radiology. Radiology began with the discovery of X-rays by Wilhelm Röntgen in 1895. The first technology was used with X-rays was glass plates, and these glass plates would translate the images and allow radiologists to read them. It wasn't until 1918 that film was developed and used more widespread. Today we use almost everything digital on computers and through the internet. In the early days, technology was utilized for therapy, and it was used for the treatment of small skin lesions, but throughout history it's become more of a technique to diagnose patients, so to look on the inside of bodies and figure out if something is damaged or needs to be fixed. Okay, so a little bit about the different types of radiologic technology. X-rays, like I mentioned before, are the oldest and most common form of radiology. I'm sure almost everyone has had an experience where they needed to get an X-ray. They specialize in looking at dense calcified structures, which are bones in our body. And they're actually some of the safest forms of radiologic scans because their exposure to radiation is minimal. And sometimes you also have to have a lead sheet put over yourself, and that kind of will just help your internal organs to just deflect the radiation that could damage your body. Okay, another type of radiologic technology is computer tomography scans. These are also called CT scans, and they're similar to X-rays, but they're more specialized. In this type of scan, a patient lays on a table and moves through a large donut structure, which it can sometimes be claustrophobic for some people, but CT scans take a matter of minutes. They don't take very long at all. They give cross-sections of the body, and these cross-sections can come together to make one image of a person's body, and the radiologist can look at that and determine if something is damaged. CT scans also can utilize a contrast material, and this is something that can be administered. You can drink it or it can be injected, and it allows this scanner to kind of pick up on a different color or density in your body and contrast it more so the radiologist can see it easier. Okay, another type of radiologic technology is magnetic resonance imaging scans, also known as MRIs. And MRIs are basically the same thing as CT scans. They give cross-sections of the body just like a CT scan, but they pick up on softer tissues such as your brain, your tendons, your ligaments, things like that. They're also the best image quality out of all types of radiology scans. The only downside to MRIs is that they can take up to an hour, and they have the same type of structure as a CT scan. They use the donut structure again, and so if that takes an hour, some people can get really antsy and nervous in there, so that's the only downside to MRIs. The last type of technology is ultrasound, and It uses a small probes placed on the skin to send sound waves into your body, and when the sound waves hit internal organs or a fetus or your heart or something like that, it sends the sound waves back, and that probe is able to develop a picture of your internal organs. So it makes the picture. A special type of ultrasound is a sonogram, and that's when the sound waves hit off of the fetus of a pregnant woman and develop a sonogram picture. And another special type is an echocardiogram, which is of your heart. Okay, so some careers in radiology. Radiology technicians are the foundations of radiology. Technicians are the people who interact with patients on a daily basis. They administer and collect scans. They have to know how to work different types of machines and how to prepare a person for their scans. Technicians can specialize in any type of radiology. This includes X-ray, sonography, nuclear medicine, and X-ray techs make on average about $47,000 a year. Radiologists are the physicians and doctors that work in the field of radiology. They're the ones that diagnose and look at scans, see what's wrong, and then they will work with the actual physicians that are working directly with the patient to try to come up with a treatment plan based on what they found in scans. To be a radiologist, you have to go through 4 years of undergraduate, 4 years of medical school, 4 years of residency, and then a year of fellowship if you want to go into a specialty such as sports medicine or mammography or something like that. Radiologists have a yearly salary of, on average, about $507,000. So a lot of schooling, but it pays off in the end. In conclusion, the field of radiology is constantly growing with new technologies, and radiology is a field that affects everyone today in some way or another. It has many types of scans that can help you with any condition you may have, and also it has a diverse number of career opportunities for any person with any interest. So, thank you.